Hello everyone, I am Dr. Bhupal Nayak, urologist in KIMS hospital, Gachibowli. Today we want to talk about kidney stone prevention. Generally, what everybody knows is if you drink more water, like 3 to 4 liters of water per day, it will wash out any stone forming particles in the urine. And along with that, the most important one is we have to reduce the sodium intake. It means indirectly the salt intake. So every person, one person has to consume only half teaspoon of salt in 24 hours. That is the recommended daily allowance of sodium. It contains around 1200 to 1300 mg of sodium. And along the third most point is the patient has to take in citric acid rich fruits like oranges, lemon juice, kiwi fruit, like that. They have to take on a seasonal basis, on regular basis. And along with that, there is a myth that we have to, if you over consume some vegetables and fruits like that, that will lead to the stone formation. It is not like that. If you consumed any food in moderation, then it will not lead to formation of any stones. And another myth is taking of calcium tablets will lead to the stone formation. It is a myth actually. Generally, we have to take enough recommended daily allowance of calcium daily, because this calcium will bind to the oxalate, which is the main stone forming part. It binds to the oxalate in the intestine and it prevents the absorption of oxalate. So it prevents the stone formation. There are certain conditions which might lead to increased calcium formation in the body, that will lead to the stone formation generally. So if we have to follow these three, like increased oral intake of liquids, only water that includes, that does not include any toddy or beer or cool drinks like that, and low sodium intake and citrate rich foods.